In 1928, a Scottish bacteriologist came back from holiday to a messy lab and a contaminated dish. A blue-green mold had killed the bacteria around it. Alexander Fleming had just stumbled onto the most important drug of the 20th century. He published it, named it penicillin, and never patented it. He believed a medicine that could save the world should belong to the world. 16 years later, the method to actually mass-produce the drug was patented, not in London, in the United States, and the country where penicillin was discovered would end up paying royalties to make it. Here is the distinction that this whole file turns on, and it is the distinction patent law cares about most. Fleming discovered penicillin. He did not invent a way to make it in useful quantities, and for over a decade, nobody could. The mold produced the drug in traces. You could grow it in flasks and barely extract enough to treat a single patient. So the thing that was genuinely missing was not the discovery. It was a manufacturing process. And a process is exactly the kind of thing a patent is built to protect. At Oxford, Howard Florey and Chain turned Fleming's curiosity into an actual medicine, purifying it and proving it cured infection in people. In 1941, the team faced a question. Chain wanted to patent the production method. Florey refused. He thought patenting a life-saving drug was unethical, and he took the question to Sir Henry Dale, one of the most senior figures in British medicine, who agreed. The Medical Research Council's secretary, Edward Mellenby, made it final no patent. The British decided deliberately to give it away. The Americans decided deliberately not to, because Britain was at war and short on industrial capacity. Florey and his colleague Norman Heatley crossed the Atlantic in 1940, one to find someone who could scale the drug up. They ended up in Peoria, Illinois, at a United States Department of Agriculture fermentation laboratory, and there the bottleneck got solved. A researcher named Andrew Moyer, working with the lab's fermentation chief Robert Cogill, found that feeding the mold corn steep liquor, a cheap by-product of cornstarch, dramatically raised the yield. Then American industry, including firms like Pfizer, pushed the process into deep tanks, growing penicillin in enormous submerged vats instead of flasks. The patent that came out of this describes the leap precisely, where older methods gave a few Oxford units of penicillin per milliliter. The new method reached as much as 200. That is the difference between a laboratory curiosity and a drug you can ship by the ton to wounded soldiers. The British had handed over the science freely, in the spirit of an open wartime alliance. What they had not anticipated was who would own the machinery that made it usable. Moyer filed for a patent on the production method, and the gift began to acquire a price tag. The patent is United States Patent 2,442,141, method for production of penicillin. Inventor Andrew Moyer. Filed in May 1945, granted in May 1948. But there is a wrinkle that makes this case sharper than a simple story of America patenting a British gift. Moyer was a United States government employee. Under the rules, he could not take a personal American patent for profit. So the American patent was assigned to the United States government and left free for American manufacturers to use. To collect for himself, Moyer filed for the same process in Britain and licensed it there. So the structure that emerged was almost a perfect inversion. In the country that discovered penicillin and chose not to patent it, the production method was now patent, protected, and licensable. British companies that wanted the efficient American deep fermentation process had to pay for it. In April 1945, Glaxo signed agreements with American firms, reported to involve royalties around 5% of sales for 5 years. Over the following decade, Glaxo is reported to have paid on the order of £500,000 in royalties. The drug was free, the way to make it was not. Fleming, when he understood what had happened, was reported to be furious, saying, in effect, that he had given penicillin free to humanity and asking why it should become a profit-making monopoly of manufacturers in another country. But notice what actually occurred, because it is more subtle than theft. Nobody patented the discovery. Fleming's penicillin, the molecule, the cure, stayed in the public domain exactly as he wanted. What got owned was the process, the engineering that turned a trace compound into an industrial product. The British gave away the part that was scientifically glorious and legally unprotectable. The Americans patented the part that was unglamorous, practical, and exactly what patent law rewards: a repeatable method. And there is the comparison that defines this file. Robert Kearns owned a clever combination and spent 17 years forcing the world to pay for it. Fleming, Florey, and Chain owned nothing by choice and shared a Nobel Prize instead. Both stories prove the same law from opposite ends: the discovery is not the asset. The asset is the claim, and the people who file it keep it. That is the lesson of the gift. You can give away the most important medicine in history and still watch it become a licensed product, because the law does not reward the breakthrough. It rewards the paperwork on the process that makes the breakthrough sellable. Florey was right that penicillin should belong to everyone, and it largely did. He just learned that everyone includes the company with the patent on the tank it grows in. Next time's an inventor who did the opposite of give it away and patented something so simple a court had to decide whether it was an invention at all.